Welcome to Cancer Close-Up. Our topic today is WVU Medicine's program for adolescents and young adults with cancer. My name is Dr. Patrick Tomboc. I am the Division Chief for the Pediatric Blood and Cancer Center at WVU Medicine Golisano Children's Hospital. We're joined with Dr. Lyckholm.
Hi, I'm Lori, and I'm a professor of adult hematology oncology at WVU Medicine Cancer Institute. And I was going to just start off by talking about the AYA, is what we call it, Adolescent and Young Adult Program at WVU Medicine Cancer Institute, and just talk a little bit about it. We started about 4 years ago because we were following along with multiple other centers that have AYA programs. And the AYA programs are for young people, adolescents and young adults, mostly ages 15 to 39, who have sort of at any point in their cancer diagnosis and experience. And if you really stop and think about what it must be like to be a young person and just sort of going along with your life, making friends, thinking about your career, thinking about relationships, thinking about the fun that you want to have tomorrow and the next day, and all of a sudden you're diagnosed with cancer. And it's just, it's devastating, not only for the patient themselves, but also for their loved ones, their families, and their friends. And so if you think about that, there are so many needs that are so special to those patients. And the first thing that we wanted to be able to provide for those patients at WVU, just like the things that are being provided all across the world, basically. AYA started probably about 15 years ago. So the first thing we did was a needs assessment of the West Virginia patients in that age group, and did a survey and said, what are the things that you are bothered by? What are the things that you really need? And the things that they told us that were very specific to our patients across West Virginia, parts of Ohio, parts of Maryland, and parts of Pennsylvania were reproductive needs. They sometimes said that no one had asked them if they wanted to have children. And you can imagine that not only chemotherapy, radiation, but the cancer itself can cause problems with fertility. So being able to offer reproductive services to every single patient, no matter whether they are thinking about having children, some people that are, 15 or 16 haven't even thought about whether they even want to ever have a family, but that's a really important thing for every person. Psychological services to people to talk with about the things that you're going through, between body image, interruptions in your relationships, in your career, in your schooling, things like that. Financial counseling. Cancer is really toxic to your economic system, whatever it may be. And so that's a tough one. The patients also wanted physical rehabilitation. They wanted to be able to know how to get back to where they were from the standpoint of their physical function. And spiritual counseling was also on their list of needs. And then the final thing was they really wanted to meet other people their ages that are going through a similar experience. So one of the things based on that and all those other needs, we started to work on developing resources for them, accessing the resources we had and being able to offer to them. And the needs to meet other people their ages that were going through cancer, we developed a series of meetups, and I'm going to ask Dr. Tomboc to talk about that.
Yeah, so the needs assessment was awesome because we got to figure out, really what these patients really wanted, what was important to them. And I think the one that stood out to me and the one that, most resonated with me was this idea of community, finding people who had that same experience, finding people who went through what they went through, and finding that commonality, that similarity. Because, we live in a very rural state, a very rural area of the United States. And because of that, a lot of our patients will never meet another person their age who had the cancer they have or had a cancer at all. And so they, I think that alone is so very isolating and so very, feel that feeling of alone is something that permeates all of, pediatric and adult cancer, feeling like you're the only one who has this disease and you're the only one who's going through this process, because it's not fun. It's terrible, right? But when you can find someone who's had that same experience and gotten to the other side, when you can find someone who's going through that experience at the same time you're going through that experience, I think that gives you personally a level of comfort to know that, someone's been through this or is going through this and is having the same experience as you, or is just starting it, and you can be that kind of community for that person. And so, that's kind of what spurned this idea of just, kind of setting an organic area where we eat, we do some sort of activity. We might talk a little bit about something that's pertinent to, to this population of patients, and do it in a place that's, doesn't require that you talk, but sort of organically pushes people together so that they can find out what other people have, can find out what other people's experiences are, and to see if their experiences are somewhat alike, and to some extent they're going to be alike in one way, because almost all the patients have had chemotherapy, radiation, and or surgery, and so they always have this one commonality to talk about and one commonality to honestly bond over, and I think that's the thing that I've seen in these meetups is, two people who live 3 hours, are separated by 3 hours of geography and hundreds of miles, but they find some happiness and some comfort in the person that they're talking to, because they also didn't have hair for 7 or 8 months of the last year, or had a port to have their chemotherapy infused and now have a scar because they're off therapy. And a lot of times, a lot of these patients will have scars in the same place because our surgeons are, we're all creatures of habit, right? But scars will be in the same place, so they'll have like matching scars, and those things are really cool to see. Seeing people find, I don't know, there's a sense of, at least maybe I'm just seeing into it, but I feel like there's a sense of relief that comes from knowing that you're not alone, knowing that you're not weird, knowing that you're not broken, knowing that someone else is the same kind of weird you are, all that. There's comfort in that. And seeing that comfort in these meetups has been probably my favorite thing to see. And it's really what I think gets to the core of what the survey found. Like, they're looking for patients who've had cancer or who are currently in cancer therapy are looking for people who have had that same experience, so they can understand what's going on, understand how they went through it, and then figure out how they're going to get through it themselves. And so I that is, easily one of my favorite parts of what we're doing for AOA right now, is getting people together, getting them to find that person who has roughly the same experience they have. And I guess the other part of it is, even if they don't find a person like that, we're doing more and more of these kind of meetups, and we're going to try and do them in different parts of the state to try and hit as many patients and as many communities as we can. And I think that's going to be the beautiful part about it. Even if you don't find someone or a group at the first one, we're going to have multiple throughout the year in different parts of the state. The more you go to, the higher likely you are to find someone who had either the same disease you had, or roughly the same chemo or surgery or whatever. And I think the more we do, the more community we'll provide. And I think that's also going to make what we do better, because the bigger a community we have, the better we can assess their needs, find out what other things they need, and address those. Or if it's just more community, we can make these experiences better, make them more involved, make them more organic. Things like that, and that really speaks to why I do what I do, but also why I do this. I love helping people get through this really devastating kind of moment, right? When they're diagnosed, it's just everything kind of falls apart, and there's chaos, and it's like a hurricane. There's just a billion emotions and a billion ideas. Kind of solidifying that down into, this is, we've got to deal with this. This is what we have to do to get to the other side, and getting them there. Honestly, that has not that it's easy, but that's been the most straightforward part, for the most part. That's been the most straightforward part, getting them through the other side. and getting them through therapy has been, it has its intricacies, but we get there. Helping them out when they're on the other side, that is what the AYA program for me does. Our older kids who have had therapy when they're younger and are now 18, 19, 20, 21, finding community for them and finding services for them to thrive after therapy, that's what drives me right now. And that's why I love this part of my job. Laura, what drives you? What has driven you to AYA, and what drives you to do all the stuff that we've been doing?
Oh, gosh. Well, you said a lot of things that I resonate with. And I feel like I've taken care of lots of young patients, young adults, mostly, in their 20s, in college, in their 30s, getting their careers started. I just graduated from engineering school, and I've got my first real job, and I just got leukemia. And it just shuts everything down. And you never forget those patients. I mean, you think about them every day. You turn the light switch on and you think about that person that just got out of electrical engineering, and you think about how you could have helped them. And this AYA program is just a way to help people, like you said, get through to the other side. That's just such a great way of looking at it. And that's my why. And going to those meetups, just like you, it is so much fun, and it's so neat to see people. We've had our first meetup was at a burrito shop, and we had about 20 people there, patients, families, and several of us. And I thought that it would be really sort of awkward, and they sort of started talking, and it went on, and then we sort of shut it down, and then they stood in the lobby and talked for another 45 minutes. And it was so exciting. And that's what happens every single time. People, they get together and they meet each other. And some of them, there are several people who come back every time now. And everyone is welcome, by the way. And we'll talk about that at the end. And it's just really neat to hear them talk about what they want. And we've moved from deciding where they'll go next for their meetups and what they want to do to asking them. So we've done the Wow Factory here in Morgantown, in Art Space. We've gone to several restaurants. We've gone to a couple of baseball games, WVU baseball games, and just all kinds of things. We get a little bit of funding here and there, and WVU the Cancer Institute has been really supportive. They really believe in what we're doing. So that's my why. I think it's a lot like yours. I think we love our patients. That's really the why. So I think we're about ready to wrap up and talk about how to get a hold of us.
Yeah, so the program for adolescent and young adults at WVU is really for any person 15 to 39 that has been diagnosed with cancer and is actively in treatment, or is through the other end and is now off therapy. Anyone is welcome in the area. So if you're watching this and you are in drivable range, email us or check out our website. All of our information is there. All our socials are there. It's wvucancer.org/AYA. You can sign up for sign up to get on our email list. We'll be emailing out the next event, which I believe is bowling. I think it's going to be bowling at Suburban Lane. So,
and also they can tell their doctor, nurse practitioner, social worker, nurse, and they'll get a hold of us.
So just if you see this podcast, go to the website. Ways to contacts are on there. All our socials are on there. Have your doctor reach out to us. We can reach out to them. We can let them know when our events are happening, where they're going to happen. But I promise you, there are going to be a lot more events. We're going to be doing a lot more every year until this population tells us they want to do something else. And so yeah, if you have any questions, please reach out. We're available to help out.